Right, good morning, everybody. I think we'll get started now. Thank you very much for joining Hestia's event for our London Mental Health Index today. My name's Gail Lowry-Jones. I'm the Executive Director of Development at Hestia. I have the privilege of being the chair for today's event. You're going to hear from some fantastic speakers today once we've had our presentation on our findings from the Mental Health Index. And I would encourage people to use the question and answer function, please. Please do submit any questions that you would like for the panel to respond to. So I'd really like to thank everybody who's on the panel today, and for everybody who has joined us so far. So I'm going to introduce each of the speakers, but before that, I'm just going to briefly introduce Hestia to those of you who might not know us. So at Hestia, we have over 55 years of experience of supporting people to have a life beyond crisis. Our approach, which we call the Hestia approach, is based on working together with our service users, really drawing on their experience, their expertise, and their strengths. It's about resolution, it's about resilience, it's about recovery and empowering people through technology, which we will also hear more about today. So we have 5 specialist strands of work across the organisation: mental health and complex needs, domestic abuse, criminal justice, modern slavery, and latterly employment support. But mental health really runs through everything that we do as an organisation. It's a real golden thread through all of our service lines, but we do run regulated care services for young people and care leavers, and high support mental health accommodation services as well. So we merged with Twining back in March of this year, and I have described Twining as feeling like the missing piece of the puzzle for us as an organisation, really being able to see and support people at later stages of their recovery into employment. And Ollie is going to talk a little bit more about that later. So first and foremost, I'm going to introduce Usman. Usman Luna is our Director of Development at Hestia, and he is going to take you through the findings from the Mental Health Index. Thanks very much. Usman, over to you.
Thank you, Gail, for the introduction, and hi everybody, and thank you for coming along. So I'll be taking you through our findings from the London Mental Health Index. So back in June 2024, Hestia launched the London Mental Health Index, which is an annual research report aiming to develop a deeper understanding of Londoners' mental health and monitor their trends over time. We have now conducted this year's study where, in addition to asking about mental health, we are also asking about employment in order to explore the current relationship between work and well-being in the capital. In March 2025, we launched our second annual calling for findings to better understand how people in London were feeling about their mental health. From the survey, we received around 2,000 responses from Londoners. All respondents were aged 18 and over. They were asked about their experiences of their mental health, as well as questions in relation to their individual finances and employment situations. Many of the survey questions we decided to ask were reported from previous years, allowing us to monitor these trends over time. So, mental health, and what did we find? 58% of our respondents experienced 3 or more symptoms of poor mental health in the past year. Some of the symptoms that were listed were inability and short temper, irritability and short temper, poor concentration, and finding it difficult to control emotions. This was a significant increase from 49% reported in 2024. Most of this increase came from people feeling nervous, anxious, or on edge, which in comparison to 40% in 2024. Feeling overwhelmed was also a significant contributing factor, which was reported at 39% this year in comparison to 35% last year. So mental health, and who is most affected? 1 in 5 Londoners reported experiencing financial strain, which included things such as difficulty paying bills, having to skip meals, or borrowing more money. The same group of people were also more likely to experience poor mental health, with 87% experiencing 3+ symptoms and 2/3 reporting 5+. Younger people were also more likely to report their mental health challenges, with 2/3 of 18 to 34-year-olds experiencing symptoms of poor mental health, which is up 12% year on year. We can not just see from the data collected, but the people we encounter through our services on a day-to-day basis, that this is also impacting the normal things we do on a day-to-day basis in life, which is things like socializing, personal hygiene, eating, and sleeping. That's when it's more than just an up and down mood. A higher proportion of women in London also experienced symptoms of challenging mental health in the past 12 months, which was 62% in comparison to men at 54%. This discrepancy may be linked to men feeling less confident talking about their mental health. One notable difference in the 2025 research is that while female respondents are still reporting at higher levels, the gap between the two groups is narrower than it was in 2024. Now for a short story from a service user who presented at one of our Crisis Cafe services. For those who are not aware of what a Crisis Cafe is a safe, supportive, non-clinical space where people experiencing mental health crises can receive immediate help, guidance, and emotional support outside of a hospital setting. They're typically open evenings and weekends when other services are unavailable. I'll be talking you through a story from Mina, who was supported by Hestia Crisis Cafe when she felt her mental health deteriorating. So Mina came to London with great hopes of fulfilling her dream of becoming a drama teacher and exploring opportunities in the theatre. However, shortly after arriving, she experienced a frightening assault on the street, which left her deeply traumatized. This pattern of events meant ending up falling into a job she wasn't passionate about. She could feel her mental health gradually deteriorating and knew about a local crisis cafe that could support her without an appointment. She was quickly able to start talking to someone and talk to them about her situation. She explained how working in an educational setting, regularly dealing with disrespectful students, false accusations, and all with what felt like no support from senior staff, it felt like her hopes of a dream career were gradually disappearing. From the very first conversation she had with her support worker, she said she felt seen, heard, and safe. She was shown simple grounding techniques to manage her panic attacks and gently supported in working through the emotional weight of job-related stress. With encouragement, she began to reconnect with the things that brought her joy, like weekend theatre and meditation. This helped her feel more balanced and in control. Slowly but surely, she found the courage to take small, meaningful steps forward, like setting aside time for job searching. Together with her support worker, she broke big, overwhelming goals into manageable actions, and that made all the difference. In her final session at the cafe, she felt proud of how far they'd come. She's now accessing counselling, actively working through an ADHD diagnosis, and confidently applying for new roles. More than that, she has developed a stronger, more empowered mindset and left with practical tools to support her both at work and in her everyday life. This now leads me to talking about the link between mental health and employment. More than 2/3 of the survey respondents who were unemployed felt that their unemployment impacted negatively on their mental health. Of those who were unemployed, 56% reported being satisfied with their jobs and 20% reported that they felt dissatisfied. 64% of the people who were dissatisfied reported that their employment situation negatively impacted on their mental health. Some of the major symptoms that were reported were problems sleeping, difficulty doing the things they enjoy, and difficulty in having a social life and making friends. People aged 35 to 54 were the most likely to be feeling financial pressure, followed closely by those aged 18 to 34. Older adults, especially those over 55, were less likely to report money worries. Unsurprisingly though, people living in households earning 30,000 or less were struggling more than those with higher incomes. Now for another story from a service user called Ali, who was supported by a Hestia Twining Hestia employee development specialist. Ali, as part of his mental health condition, lost the ability to talk. So he started off his journey of recovery by trying various social groups. Although the social groups were great for him, he really wanted to work. When he saw Hestia's employment support program, he was grateful that there was an organization that could help him with his employment ambitions. Ali started off by being an influencer online, creating outfit videos. Big brands started to take notice. Now he was also getting invited to events hosted by some of the biggest fashion brands. Here he said his mental health has really benefited from being immersed in work that he enjoys and that suits him. This is a story of how, by just taking the first step, can make such a positive difference, and how the overwhelming feeling of fear can keep us distant from the things that bring us the most joy. To conclude, mental health is a mainstream experience. Addressing the challenges requires coordinated, cross-sector, community-based action. And key to this is having accessible crisis support in local communities, providing compassionate, person-centered support to people without work, rather than just applying sanctions, enabling them to meaningfully contribute to the community. Removing barriers to work and supporting people into good employment includes employment support within the NHS and creating stigma-free workplaces. And also, finally, tackling the link between feeling under financial pressure and mental health. Thank you very much.
Thanks, Usman. That was great. I hope people have found that really helpful in terms of getting that information. I'm going to ask the panel now for their reflections on that presentation and on the findings, and would like to introduce Remus to everybody. So Remus is a lived experienced expert, and I'm going to ask Remus to feedback his reflections first to everybody. Over to you, Remus. Thank you.
Hi, hello everyone. Thank you for this opportunity. So yeah, I deeply relate to what has been presented. I just I will start by explaining a bit about myself, my journey, how I get to be an IPS employment specialist. So over 10 years ago, I studied social work. I was feeling to connect to people. I was able to, and now I feel easy to connect with people and listen to people. And after that, I discovered my passion for photography, and I studied BA. I have a master in photography, and at the same time, I was running two small businesses. One was event photography, and the other one a wedding stationery business. Sadly, after a few years, I have to give up on event photography because of my health. I had really back pain, and I couldn't do it anymore. So then I was focused on my stationery business, which started to grow. I was investing time, dedication, money, and then I got even professional support, mentoring. So I was fully on board to grow this business. But after a year of fighting and just all the support I got, and I took time from me and from my family and put it in a business, and after a year I got nothing in return. So I had no money. I was in debt. I had to move from my flat in London, because landlord she wanted to sell the flat, and I had no money for deposit. Even I had a poor credit score, so I was tight. I didn't know what to do. So this was a big impact on my physical and mental health. So I was feeling sad. I was not doing anything when I was angry on myself, on my situation. And at some point my wife said, you have to do something, otherwise I'm gonna leave you. So it was another level of stress. And then I couldn't do anything. I felt like I felt so much pain on my chest. So I contacted the GP and I went to the hospital, scans, MRI, heart and blood test, and all were like negative. I was fine, but I wasn't feeling well. So at one point, I remember that evening, the GP called me like about 8 p.m. and asked me, "How do you feel? I'm worried about you because it's heart related." So at that point, I was feeling really low and just I said like, I don't know, just I can't do it anymore. I'm stressed out, and there was that turning point when the GP read me and just understood me and said, "Do you want someone to listen to you, to talk to someone?" Oh, yes, I said yes, because it was the first time ever I felt I had this feeling in this situation. I am a positive and optimistic person, and I always find a solution for each issue in my life, but that moment I couldn't. So the GP referred me to talking therapies. I had 10 sessions, and that was a great, it changed my way of seeing things. So I prioritized my task. I managed how to worry less about things, and it was great. After 10 sessions, I said, yes, I'm good enough to improve my situation, but wasn't, because I didn't, my business still was down and went down, and no money to move out from my flat. And then they referred me to Twining Enterprise at that moment, which now is Twining Hestia. And they helped me with finding new ways, strategies to develop my business. And because still I was struggling, they referred me to another employment specialist from Twining Hestia to find a part-time job, to find something, some money to support my family. And then it was a great experience. They were so friendly. They were so supporting. I didn't know just do I deserve that? I asked myself. So after let's say 2 months, I was at the same time moving from my flat to a house outside London with support, financial support from one of my my family. And then the employment specialist asked me, "What do you think if you work to have a job like me?" So I said, "Is that possible? I have no experience. I never worked in NHS environment." But she said, like, you have the skills, you have that social work study, you have customer service experience, you have that feeling for people. I can see your skills in your CV. So I was really happy. So I applied for the job. I got the job. I was successful, and now I have 7 months in the job. So I'm really happy here. And this experience, it's a proof that the system works. I'm thinking now back. I see a positive journey, because even now I was challenged by life, but I see a positive outcome, because the chain between the GP, talking therapies, Twining Enterprise, Twining Hestia, and the employment support, and then being on this side supporting people and just listen to people and support them and find a job. I now I relate, I understand them. So this is my story. So I'm proud of myself, because I managed with your support to to find my way to being healthy. So this is me. Thank you.
That's really wonderful, Remus. Thank you so much. It's very generous of you to share that story, to share your story with us. And I think I was really struck by you talking about, I couldn't find the solution. I couldn't find the solution on my own, and being able to have support from professionals and from family. I think it's really important, and we all need to really recognize that we shouldn't always have to find the solutions on our own, and having those kind of networks and support mechanisms is really important. So thank you so much for sharing with us
Thank
today.
You so much.
That's great. Wonderful. I'd now like to introduce Rebecca Gray. So Rebecca is the director of the NHS Confederation's Mental Health Network. So I'm going to pass over to Rebecca for her reflections. Thank you
so much. And Thank you, Remus. I thought, I was really interested in one of the final points you made, which is about the connection, seeing all the different pieces come together, the conversation with the GP, the connection through to the different support services. And I suppose that's what I was going to touch on today, really. I think the index report sheds a quite a challenging picture, but one that aligns with lots of other research and work that's out at the moment, including, I don't know if the people saw, the Young Futures report last week, which had a lot of aligned messaging about what is driving concerns for mental health in terms of young people nationally, and there's a lot of links through. This session is in the kind of aftermath of the publication of the 10-year plan for the NHS, and the word that is absolutely the most frequent word in that plan, I think, is neighbourhood health. And that kind of goes to the heart of, I think, what we're talking about today, which is not about which systems we use or which bits of the NHS do what, but what do people's real lives in the communities in which they live require of the public sector to support. So the concept of neighbourhood in the plan, I think, is used in lots of different ways. So there's things called 24/7 neighbourhood centres for adults with severe mental illness. There's talks about new ways for primary care to work with neighbourhood health providers and integrated neighbourhood health provision at place, and lots of sort of words that aren't entirely clear yet how they will play out. But I think it's probably talking about two things. One is that the majority of your care should be in your community and near your home, whether that's digitally enabled, whether that's about GPs having more time, whether that's about, less focus on hospital services, more on what happens local to you. But I think the more relevant meaning is about how to provide really integrated care and support across health, not only health providers, but a holistic view which integrates health interventions with social interventions, whether that's employment support, housing, financial advice, in a way that genuinely responds to people's broader physical, emotional, social, psychological needs. And I think that is a further recognition of what has been long understood as the reality of what people need, particularly by the voluntary and community sector. And there have been many efforts. There are many brilliant examples all over the country of really effective working cross-collaboratively between NHS and voluntary and community sector organisations to deliver that. But I think this is a further step in that recognition, not only recognition that it's what people need for health, but it's also what the economy needs in terms of making sure that we have a population that feel able to work and supported in work. So I think there is much in the plan that to some extent reinvents the wheel, but I don't think that's a bad thing if it's pointing in the right direction. That cross-cutting approach, whether it's in neighbourhood health, whether it's in thinking about crisis care and emergency care for people who are in mental health crisis, which I know Hestia plays a really important role through your crisis cafes, one of which I visited earlier this year. These things, it's not going to be a question of one model fitting every locality and fitting every, working for everybody, whether it's emergency mental health departments that are going to be attached to hospitals or more support for crisis pathways that include things like crisis cafes, recovery cafes, crisis lines that are really integrated with local communities and can direct people to support which is outside the NHS. It's all going to be really important. It's really positive, the commitment to IPS that we've seen in the plan and employment support as part of the broader kind of solution to some of the challenges that we are facing as a society. If I was going to flag a couple of concerns at this stage, and I represent NHS organisations and a mix of voluntary and community sector organisations and independent sector organisations that provide care through the NHS, or funded by the NHS. I suppose it's making sure that the NHS doesn't try and do stuff that's better done by the voluntary and community sector, and that we get the commissioning of all this kind of connected and collaborative support right. And that's a complex picture at the moment, with changes in integrated care boards, with change in strategic local authorities, and keeping focused on what do people need, what are the outcomes that we can demonstrate from that work, and trying to point in the right and the same direction.
Brilliant. Thank you so much, Rebecca. I think it's really important that we're looking at that kind of devolution to the voluntary sector. It's something that we've been involved in for a number of years now, and both in terms of our mental health crisis recovery cafes and the houses that we run as well. So for a slightly longer stay for people to reset in their communities, to be able to stay well and out of hospital. So yeah, really, really important. Thank you so much for that. I'd like to introduce now Elizabeth Taylor, who's the Chief Executive of IRSA, Employment Related Services Association. So I'm going to hand over to you now, Elizabeth. Thank you so much. Elizabeth, you're on mute.
That's like 2020 all over again, isn't it? When we all first went online. So how embarrassing. I was really pleased to be invited to contribute this morning. I think one of the things we spend a considerable amount of time thinking about in the employment support sector is how we make sure that employment support, good employment advice, pre-employment and in work is available to every UK citizen, and that's been one of the sort of strap lines that we've used at IRSA in the last couple of years. One of the things I was asked to reflect on this morning is the sort of the change in policy landscape that has come predominantly from the work that was done in Barnsley, that was led by Alan Milburn. And if you're not familiar with that, I would suggest that you Google it and have a look at what happened in Barnsley. But some of the things that were trialled there really fed into, first of all, the white paper, Get Britain Working, and more recently, the green paper, Pathways to Work. And what we see in that white paper and green paper is an ambition for 80% employment. There's an ambition to have growth. And alongside that, there's some ambition around addressing the NEET rate in the UK to be at least, with that real ambition of being as good as the Netherlands, which is the best. So we've been working at IRSA with employment support providers, looking at how we rise to those challenges, and we've done submissions from the sector, and we're looking at the new inquiry last week, which is about the disability employment gap. Every single one of those things has focused on, in part, not exclusively, on mental health and work and what it means. And I think that within the employment support sector, we've had provisions that work. We've had partnerships with health. We've had partnerships with the wider third sector, other agencies addressing other issues. And finally, I feel like we've got this environment where we have the opportunity to say what works, and it's really important to do that. So conversations like this morning should really be captured and fed into those things. We all know the negative impact of being out of work, but I think we've also got to be honest about the negative impact of being in the wrong job. So I'm an advocate for employment support for everybody, for open access employment support. Really impressed by the Hestia crisis cafes, and I'm not necessarily suggesting that you bolt employment support into it, but you could have things that run alongside it, and that people know where to get advice around employment. I think the other thing is there's a history in the sector of delivering things that are around health and work and always around mental health. There's the specialist provisions, but certainly in every single provision that somebody delivers about in work, mental health is taken into account. And so I think 2025 gives us this opportunity really to sort of move the dial on a little bit. And so I think things like the index that we've seen this morning, the sort of the brilliant moment when organisations that are contributing, and I know who's in the room, and I hope we get some good questions and contributions in a minute, come together. This is the moment to come together, because we can achieve higher levels of employment, we can address the growth challenge in the UK, we can address the million young people that are NEET, and the only way to do that is to bring together health support, mental health support, employment advice, other organisations working on housing, finance, other things that exclude people from the labour market, and to build on what we already know, whether it's been through Work Choice or IPS or what we'll learn from Connect to Work. We can come together and do it now. So to me, this is a brilliant conversation and should be part of something that's ongoing. And thanks for asking me to contribute.
Wonderful. Thank you so much, Elizabeth. I think it's really important that we are, as you say, coming together and being able to share experiences and really find solutions together. From a very personal perspective, I have quite significant caring duties outside of work, and members of my family have said, is it not time to take a step back from work, or to work less, or maybe not to work anymore? And I've said it's my salvation. It's what helps me to continue to be me, have my identity, and do all of those things that I feel very useful doing in a work environment. So I really value the contribution that my work has to my mental health as well, and I see the very good work that you're doing along with all the other members. So thank you Elizabeth. I know that the events team will be quietly scolding me for not reminding people to put questions into the question and answer function. If you would like to ask any questions, please pop them in there and we will come to those shortly. So last but no means least, I'm going to introduce my executive colleague, Ollie Jacobs. Ollie is the Chief Executive of Twining Hestia. As I mentioned earlier, we have just merged with Twining following a very successful integration period. So Ollie, over to you.
Thank you very much, Gail, and thank you to everyone who's shared their reflections so far. So yes, Twining Hestia, formerly Twining Enterprise, we've delivered mental health and employment support across London for over 30 years. And earlier this year, we merged with Hestia to expand our reach, bringing recovery through good employment into further arenas where people face complex life challenges. We work across North, East and West London, embedding IPS employment specialists and advisors into NHS and neighbourhood teams. And through our youth mentoring programme, Developing Futures, we support young adults across the capital. Developing Futures is built on the idea that trusted adult relationships, exposure to work and a sense of possibility are crucial protective factors for young people. And our models align strongly with the new NHS 10-year plan, integrated, preventative, place-based care that starts with what people need. At the heart of everything we do is a simple belief that employment support isn't separate from recovery, and it's often a key part of it. And we see it every day. When people are supported into work that fits their lives, confidence grows, well-being improves, and a deeper sense of identity begins to return, as Gail has just expressed. Recovery doesn't need to be complete before work begins, and in many cases, it's the chance to move forward to something meaningful that helps recovery take root. The signal from the index is unmistakable. Over half of Londoners are now living with multiple symptoms of poor mental health, anxiety, overwhelm, isolation, especially among young adults. And behind the data are real pressures, financial strain, insecure housing, relationship breakdown, and a kind of daily stress that chips away at confidence and a big sense of belonging. We see these patterns in our mental health work across London every week. In this context, work matters, not just as income, but as structure, connection, and a sense of moving forward. As Freud said, mental health shows up in our capacity to work and to love. And we see it when someone re-engages with meaningful work, something deeper often begins to repair. But the quality of work also matters. When it's precarious, isolating, or dehumanizing, it harms people. But when it's well-designed, fairly paid, relational, paced, it becomes stabilizing, and the index backs this up. 67% of unemployed Londoners say being out of work harms their mental health. 64% of dissatisfied workers say work is making things worse, but only 6% of people in good jobs say that. Good work is part of the solution. At Twining Hestia, we see the power of integrated employment support and early intervention every day. In Camden, Sarah was referred to our Talking Therapies team for anxiety. She dropped out of university and hadn't left the house in months. Through a warm handover to our co-located employment advisor, she slowly re-engaged. 6 months later, she started a flexible admin role within a local charity. Her anxiety didn't disappear overnight, but she was moving again and wasn't alone. In Haringey, Jay was supported through IPS while under secondary care. He hadn't worked in over 5 years. His employment specialist didn't rush him, just showed up, listened, stayed in step and liaised with his clinician throughout. Jay now works part-time in a supermarket. It's not glamorous, but it's stable, and for him, that stability matters. And the thread across these examples is that no one was pushed, but no one was left behind either. They were met where they were and walked with. As IPS and employment support scales nationally through Connect to Work and other reforms, there is a risk that we replicate the form of these programs but lose some of the substance that's made them work and their truly relational nature of their models. When performance targets override relationship building, or when fidelity becomes a tick box exercise, we don't just lose quality, we lose impact. IPS works because of how it's delivered, with presence, trust, and in the right place. And that means reflective supervision, practitioner learning, and commissioning frameworks that protect the space to build trust. As we scale these programs, we must scale with integrity, not just speed. Following the Mental Health Index, this is a moment that calls, I think, for urgency and care and truly relational support. And the index is a clear call to action, that mental health is not separate from the economy, housing, or education, and is shaped by all of them. And employment support has a vital role to play, but only if done well. And this means that people have expressed here, joined up models, embedded into healthcare settings, importantly, well connected to employers and really truly centered on the person. And I think, as Remus mentioned, we must build services that start with listening, that see the whole person, not just the problem, and remember that recovery isn't linear, but with the right support, recovery is always possible. Thank you.
That's great, Ollie. Thank you so much. I think to listen to people, to understand whole people, as you say, is so important, and such a thread that runs through a lot of the work that we do as an organisation, and now as a merged organisation. I often describe us and the work that we do at the client interface as being appropriately persistent. And I think, you know, as you were describing, nobody being pushed but nobody being left behind is really where we place ourselves, walking alongside people shoulder to shoulder at their own speed to support with that recovery, whether it is about moving into employment or whether it is, you know, understanding the traumatic impact of a custodial sentence or exiting modern slavery or a domestic abuse situation and finding safety. And I think one of the things that we do as an organisation really well is to help people to feel safe. And I think, you know, that safety brings so much power for people to start looking at other things in their lives, whether it is employment, whether it is anything else that they're focused on. And I think, you know, one of the things we haven't really talked about today is about housing and the importance that housing has in people's recovery, linked to employment as well. Obviously, Remus, you were talking earlier about some of the challenges that you were facing around housing. And I think, you know, the importance of safe, secure housing alongside, you know, stable employment is really, really important for people's well-being overall. And I think, you know, when we see people coming into our crisis cafes, people do present with a whole range of issues, but some of the most common issues are around housing, are around work and education pressures, and the things that could, if left unsupported, lead to a real spiral around, loss of employment, loss of housing, and where that could kind of lead people, I think is really important for us to continue to have those conversations and to really push for, funding in that space, making sure that, the appropriate social housing is provided for people who need it, and at the right time and in the right place. So that's really helpful. Thank you, Ollie. We've got a few questions and kind of comments coming in now. I would just like to ask Remus a question, if that's okay, Remus. Just thinking about the support that you received from your employment specialist and how you worked. You talked about that kind of referral from the GP into talking therapies. If you hadn't been offered that kind of employment support after the or employment specialist through your talking therapies, where do you think your recovery might have kind of gone in that space? How important was that to your recovery?
I think it was vital for me because even I am a positive and finding positive person and finding solutions, and not be able to do it myself for support for my family was really extremely difficult for me to accept that, and I couldn't do it myself. So the support that I got, was like save my family and save my life. Otherwise, I don't know, I think I will still focusing on the business that didn't work anymore. So who knows, maybe my wife, I would just be myself without my family, and being like just one line focusing just on my business. But I need support to see the big picture, not just what I'm seeing. I need support for different views, what is best for my family and for myself. So to prioritize my health and my family health first, and then find different ways to to have a balanced life.
That's great. Thank you. I think really being that kind of catalyst to help you was wonderful to hear. We've got a question that I think I'm going to ask Ollie to respond to. So there's a question about whether IPS or Connect to Work is the main strategy. So whether or not people accessing IPS have more of a want to work and therefore kind of higher outcomes, and that people who are economically inactive and have been for some period are not quite in that same space around wanting to move into employment.
Yeah, I mean, I think at a general kind of strategic level, obviously Connect to Work and IPS are sort of part of the overall strategy of Get Britain Working. There's other programs that are involved in that, and other things within kind of community settings, whether that's employment advisors and IAT, which work with people that are in work. Obviously, the way IPS is framed is sometimes that sort of not around the readiness to work, but the kind of motivation. But when we work with people, we look at that sort of, to find that kind of spark and help people on their journey and, work at their pace, although IPS does have some contours to move rather quickly when that spark is ignited. But I think it's not really about sort of IPS or Connect to Work, but probably a little bit more about sequencing and scaffolding. So sometimes there's using, community-based low pressure support to help people stabilize, then exposing them to reconnection to their kind of purpose, and when the moment is right, engaging into kind of those IPS programs that are out there.
Thank you, Ollie. That's really, really helpful. There's a couple of questions about social media and the impact that has on people's mental health. We haven't really explored that as part of the mental health index at this point, but it's certainly something that we would look at kind of taking forward. Some questions about, as you can imagine, about neighbourhood teams And there seems to be quite a strong theme coming through about how can we ensure that employment is really commissioned as part of the core services within the NHS, not an add-on, not a bolt-on further down the stream. How do we really ensure that it is there and focused as a preventative measure? I wonder if, Rebecca, you might come in on that point.
Yeah, I mean that's what we've got to aim for. It's interesting. I'm reflecting. I had a conversation with a GP a few weeks ago who was a GP who was really, really committed to supporting patients with severe mental illness and not discharging, referring back into secondary health service all the time. And one of the questions she's really working in a really effective way as part of a multidisciplinary team with psychiatrists in the local and psychologists and others in the local mental health trust. And one of the things that I asked her was, if your patients aren't being referred back into secondary mental health services, will they have access to things like IPS and other services that other patients might do? And her response was, "Oh, well, actually, I've been trying to get some money for some employment support and I then ended up talking to the chief exec of the related NHS trust, who said, no, the patients who are within this population absolutely can not only access IPS, whether or not they're technically within our care, but also we've got relations with voluntary sector organisations that are supporting in broader types and different forms of employment support. So some of this is not about trying to, I do worry that people in different bits of the system constantly commission something new or try and invent things for themselves when actually it's out there, it's just joining up the dots. So we're meant to be moving back towards a strategic commissioning place where we're looking at population needs and commissioning on that basis. So I think there's going to be something about how do we make sure that's really well informed. I think primary care in particular, where a lot more activity will sit in primary care, and these neighbourhood based kind of collaborations, which are very well established in some parts of the country and not in others. So I think we've gone from a situation where organisations are often thinking about big area commissioning contracts through to actually quite small localities. And I think it's going to be important that we don't think delivery at community level or neighbourhood level doesn't have to mean small scale commissioning. Because I do think that there'll be we can't lose quality and consistency and, appropriate approaches in thinking about what's delivered locally. And sometimes, unfortunately, colleagues in the NHS sometimes think, well, if we mean community, we mean this a very small organisation down the road who have probably got a really important role to play in the big picture. But actually, we need to think about what is going to connect and deliver really high quality services across the patch, including multiple neighbourhoods. So, trying to embed it, I think, is partly going to be about people like our organisation sharing what's working now and understanding where really effective employment support is built into delivery for communities at different levels, and being able to make sure that others see those examples.
Brilliant. No, that's really, really helpful. I think it is that collaboration, sharing best practice, working together. I mean, we've certainly seen different commissioners looking to commission the same thing that is already being provided by somebody else, and have had lots of conversations many years ago with local authorities about integrated commissioning with the then CCGs and people in the local authority saying, we don't even know how to talk to them, we don't have contacts, we don't have those kind of relationships. So hopefully, as we continue to move forward with the new iteration of what we're trying to do in terms of commissioning, that should help. I think we've certainly seen across our services and with Twining Hestia, doing the work that we're doing in communities with people where they are working with a mental health specialist and an employment specialist, but where we're having those really collaborative approaches, has been really successful for people's outcomes. So yeah, great. Thank you, Rebecca. I'm I wanted to ask maybe either Elizabeth or Ollie to come in around how employers can work more closely with individuals about supporting their mental health, and what the role of the employer is in that mental health support space.
Should we go together, Ollie? I could just quickly say a few things and then Ollie come in. One of the things that happens in the employment support sector is that employer engagement is at the heart of what we do, and we try to address what employers need from employees all the time. But also when we're getting people with health conditions, disability, mental health into work, I think there's a really useful role the sector and specialist advisors can play in making sure the job is right for somebody. So there's a long history going back to work step, work prep, work choice, work and health programme, connect to work, the specialist provisions around it like IPS, where we do job carving and we try and make sure jobs are good for people. But I think here we are in 2025 where there's a real recognition of mental health as an issue in the workplace. I think employers themselves being very committed to their own mental health and that have existed in employees. And I think we've got to kind of up that conversation. Now, I'm not in the world anymore of being a provider, so I'm going to hand over to Ollie now. But I think if we don't put employers in the mix in all this, we're going to fail. So, Ollie.
No, absolutely. And I guess, in the world of employment support, we face the backdrop of somewhat increasing unemployment in the last sort of quarter or so, and the reduction of vacancies. So that whole sort of landscape around employer engagement has become a little bit more complex. And I'll just echo what Elizabeth said. I mean, on the IPS work, it obviously involves quite local kind of tailored job carving, and then working sort of hand in glove with that employer if the person is happy for their mental health to be declared, and working that through with them on a sort of sustained in-work kind of basis. So there have been efforts to do that at more sort of national and higher levels rather than just sort of local provider basis, I think through the REACT partnership on the Restart programme and otherwise. And I think there's lots more engagement that can be done at those levels to sort of improve the relationship between sort of the employability sector and those employers. But I also think there's a kind of larger question around that. I think you touched on it, Gail, and others, around the sort of nature of work and how employers are kind of treating and supporting their kind of staff. We, of course, had the Workers' Rights Bill with some bits moving through there, but there was one bit that was removed, which was the right to switch off. And I think just sort of looking back, into sort of 20 years ago, working without computers and texts and phones, people would go home with their families, switch off, have a meal and sort of digest. And I think we're all probably aware of sort of the creeping scope of work into sort of our evenings and sometimes weekends and kind of otherwise. And I know not just at the sort of lower paid or entry level kind of work, but those in, bigger jobs or more responsibility, that sort of creeps ever so more and builds up to the kind of stress and kind of breakdown than otherwise. So I think, a new covenant will be interesting to sort of broach with kind of employers. But of course, we have that situated against a difficult employer background, economic situation, employers' national insurance, and pressures on organisations and staffing levels, both in the private and public and charitable kind of sector as well. So I think sort of further dialogue and work kind of on that basis, how a smooth track can be garnered, because it all taps into the fact of Londoners ever more feeling the pinch with respect to their mental health. Yeah.
Thanks, Ollie. That's really helpful. I think when I introduced Hestia and I was talking about kind of digitally enabling and supporting recovery through technology, there's some really positive things that we are doing as an organisation. We've recently launched our online recovery college so that people can sign up to activities that bring them connectedness, that bring them joy and purpose and learning. And we think that is really, really important. But as you say, sometimes the more digitally connected we are, the more difficult it is for employees to switch off, to be a little bit disconnected and to be able to focus on other things in their lives as well. There is a question about support for people in work to maintain their work, and I know that that's something that Twining do as part of your IPS program. That's right, isn't it, Ollie?
Yeah, no, absolutely. I mean, that's for us, that's predominantly through the Employment Advisors and Talking Therapies program, which has been part of the various green and white papers, and achieving kind of 99% kind of coverage across the country for those types of services. So people referred through Talking Therapies can be out of work, but predominantly who are in work but off sick or having an issue with their employer or are looking for alternative work, are supported kind of through those means. And one of the challenges, I guess, in the backdrop of that, and I think it was touched on before, is just the nature of the commissioning environment, because these programs have been in for some time but sort of lurch on year-to-year contracts often. So retaining staff, keeping consistency, kind of growing it, whilst Talking Therapies have a 10-year, 15-year deal for sort of cognitive behavioural therapy. I think for the whole employment support sector, being underpinned by sustained funding, and you're able to kind of evolve it on a secure footing over a number of years and periods, is really key. So I think there's the commissioning out there. I think, as Elizabeth and Rebecca have said, there's a history of the know-how and the learnings through quite a lot of cycles. Obviously, when a new government comes in, they want to do things their way a little bit and sort of tweak and kind of tailor things, but the learning is out there, and I think just the sector and all the whole system supported to sort of continue the work and evolve it is part of the equation.
Yeah, absolutely. And I think that short-term funding issue is something that, both Twining Hestia and Hestia have really experienced in terms of some of the delivery of the contracts and the impact that has on staff who are TUPE'd from different providers, and all of the kind of the impact that actually has on service delivery. And we want to always make sure that is the least impacted, both the people who deliver it and the people who are receiving it. I'm just aware we're very close to the end of the session now, and I suppose I just wanted to touch very, very briefly before I thank everybody and we close about a small cohort of people who are unable to work. We do run some services for people with very severe and enduring mental health issues, but I see the joy that they experience through working together. So our Together network that we have organisationally, where we are engaging and co-producing everything that we do with our service users, and then moving into volunteering, and service users volunteering in their own services, volunteering across the organisation, helping in recruitment of staff for their services. I remember sitting on a panel with some service users, and two people scored very similarly, and speaking to the service users about saying, right, it's 10 o'clock at night, it's a Friday night, you're in distress, who do you want to talk to? And them instinctively knowing out of the candidates, who had scored exactly the same, what that would feel like and what that meant to them, and really being able to engage in that, I think is really, really important. So thank you to everybody who has joined today. Thank you to all of our panel. Thank you to Usman for your presentation, to Remus, Rebecca, Elizabeth and Ollie for all of your reflections and comments today. I feel like it's been a very successful event, and we've had lots of questions that we've been able to respond to. So thank you everybody very much. Take care. Hopefully everybody has a lovely rest of your day. Thank you and goodbye.
Thank you.
Thank you.
Thank you.